Hello, I'm Karen Parry. I'm manager of the library's Just for the Health of It Health Literacy Initiative. I'm so excited to talk about a program that will be happening virtually at the library on Tuesday, September 26th on Zoom from 7 to 8 p.m. called Understanding Colon Cancer. I'm so happy today to be joined by Dr. Amir Farouk. He's a medical oncologist at Astera Cancer Care right here in East Brunswick. Welcome, doctor.
Thank you so much. Thank you for having me.
Dr. Farouk has a very distinguished background. He completed his residency at the University of Tennessee Health Science Center in Memphis and a fellowship in hematology oncology at Roswell Park Cancer Institute. He has published his research in several peer-reviewed journals and was named the best hematologist oncologist in AY magazine and has won prestigious awards at the research project at the World Lung Cancer Conference. Dr. Farouk is the ex-president of EBPL Hematology and Oncology Chapter. Doctor, we're so honored to have you do this program for us. Can you please tell us a little bit about your program and what you will be covering?
Sure. Thank you for inviting me, Karen. I'm oncologist with Astera Cancer Care. As you know, Astera is a group of medical oncologists, hematologists, radiation oncologists, surgical oncologists, and we have clinics all over New Jersey where we provide world-class cancer care closer to patients' homes in their communities. And I'm very proud to be part of this group. At Astera, our physicians have done presentations for East Brunswick Library over the years on different topics, and we are going to continue this tradition. And I'm very excited about this upcoming presentation I have on colon cancer. Colon cancer is third most common cancer in males. It's a second most common cancer in females. There are around 153,000 colon cancer patients newly diagnosed every year in America, and there are around, unfortunately, 53,000 people who die of colon cancer every year here in US. We are going to talk about a lot of interesting facts about colon cancer. Men's are around 33% higher risk of incidence for colon cancer than women. Race also impact colon cancer. The incidence is around 20% higher in African Americans than Caucasian Americans. An average risk American have around 4% lifetime risk of developing colon cancer. So that's around 1 in 25. Thankfully, incidence and mortality of colon cancer is going down over last few decades, especially in those who are 45 and above. But unfortunately, the incidence is going a little bit in the upward direction in those who are younger than 45 to 50. And that's the reason for screening tests are moving in the more early age. It used to be colonoscopy at 50, and now it's at 45. We are going to talk about a few factors which can impact the timing of screening. For example, if you have a hereditary genetic colorectal syndrome mutations, the risk is higher. Sometime in those conditions, we recommend screening early. If you have radiation to abdomen in the past, if you have cystic fibrosis, that can increase risk, and the incidence could be done, screenings could be done at an earlier age. We are also going to talk about different risk factors for colon cancer, like obesity, hyperlipidemia, diabetes, smoking, alcohol, diet, especially impact of red processed meat on risk of colon cancer. We are also going to talk about some protective factors which can help reduce our risk of colon cancer, like exercise, diets, um, and some vitamins. There is some data on it, like vitamin B6, vitamin D, calcium, magnesium, hormone therapy in women, um, uh, coffee intake impact. There are some medicines like aspirin. There is some data. It can reduce a risk of colon cancer, and we're going to discuss that. Impact of some blood pressure medicines like um, ACE inhibitors, cholesterol medicines like statin, which could have some protective effect. So we will also discuss about different screening options and the data on it, like colonoscopy, sigmoidoscopy, stool test for blood, stool DNA test, CT colonography, which is a relatively newer screening method, and what option you should pick with your particular risk factors. So these are just a few of the teasers from the facts which we are going to discuss in this presentation. There is a lot more which we're gonna present, and I think this information will be very helpful for our audience. My goal is to make this presentation as simple as possible, so whatever we discuss is useful for everyone. So I think whoever attend this presentation will walk away with a lot of important facts about this colon cancer. Sometimes colon cancer doesn't get the attention like some other cancer, like breast cancer and prostate cancer. So I thought it's very important to talk about it, because there's a lot we can do to reduce our risks and to educate our family members on this topic.
Thank you, Doctor. We're so excited about this. It will be so helpful to our community. So I have one question. Who would you recommend attend this program? Just people with colon cancer?
I think this is going to be presentation with a lot of important facts about colon cancer, and that information could be useful for people with colon cancer, people who are at higher risk of colon cancer due to genetic disposition, family members of patients with colon cancer, those who are interested in learning more about screening of colon cancer, because this has been a hot topic over the last 10 to 20 years with some changes which we are going to talk about, and anyone interested in science.
That sounds so interesting, Doctor. We're so honored to have you take time out of your busy schedule to do this for our community, because we appreciate your dedication to building healthy communities, and we know that it's physicians like you that really honestly care and devote their time. So I want to remind all of our viewers that this will be an online program at the East Brunswick Public Library website, ebpl.org. It will be on September 26th. That's a Tuesday from 7 to 9 p.m. So please go to the website for all the details to register. And we hope as many people will tune in as possible. And thank you so much, Doctor, for your time today.
Thank you so much, Karen, for giving me this opportunity.